Right. Hi, I'm Dr. Deuk Majan. Guys, I've got to be able to see this x-ray. Monica, come on. Well, I don't know what to tell you. You got to get it right. We're getting ready to do a surgery, a Deuk laser disc repair. Let me just focus for a minute. 2, 3, 4, 5, 6. Everyone agree that's 5, 6 there? I need a better view of it, Monica. Shot. 2, 3, 4, 5, 6. Shot. No, it's not. I can't see enough. I got to be able to see down below, Monica. All right, that's what I need right there. Shot. I'm going to need a quick AP. Quick AP. Just get it in there and get a shot so I can see where this needle is. Go, quickly. Swing it. Shot. Shot. All right. It's not too bad. Let's go lateral. Quickly, please. All right. Shot. Such a bad picture, Monica. That's not going to help. You got to figure out how to get a better picture. Why did you let Jordan go? Honestly. That's pretty bad. All right. Just give me an AP. That's better, but it's still horrible. You're way overexposed. 2, 3, 4, 5, 6. That's it. Relax on the arms. Relax on the arms. Shot. All right, that's pretty good. All right, lateral. So this patient is having the Deuk laser disc repair. She has a herniated disc at C5-C6. It's causing problems for her with neck pain. I got to be able to see the disc itself. Monica, I need you to get that better. Right now we're struggling to visualize the spine properly. That is better. I'm going to inject a little dye shot. All right, good. Apologize for the quality of the x-ray. I used to call you when Jordan wasn't doing a good job. Now I have to call Jordan when you're not getting it right. Shot. But you do MRIs well, so we won't give you too hard of a time. But Jordan has really gotten quite good at it. Well, fortunately, we're only doing one disc. So at this point, we are inside the disc. And everyone agrees we're at the proper disc, correct? So 2, 3, 4, 5, 6. Our guide wire is in position. I'm going to give a little numbing medicine because we're going to make our incision. The numbing medicine has a little lidocaine, marcaine, and epinephrine. Most of it went outside. But the incision is 4 millimeters. It's tiny. The whole surgery is done through a 4 millimeter incision. This is the smallest incision you can make to do spine surgery. There is nothing smaller. It's the least invasive spine surgery there is. I don't consider injections to be spine surgery, so I'm not counting injections which are done with a needle. But surgery is done with an incision, and this is a small incision. It's a relatively bloodless surgery, the Deuk laser disc repair, because we may lose about 20 drops, 30 drops of blood, usually shot. So the blood loss is quite minimal. And as far as complications go, we've been very fortunate. We've had 0 surgical complications from the procedure. All right, I got to be able to see the spine a little better. So I think you're too far south, to be honest with you, with the fluoro. But this is stuff you got to be able to figure out. Shot. That's better. So 2. Just can you darken it up a little bit? The shot's fine. You gotta just post processing. Just darken it up. Yep. I think that's fine. 2, 3, 4, 5, 6. All right, that's good. So here you go. All right, at this point, let's get an AP. So I can see the tip of the dilator is right in front of the spine. I just want to make sure it's in the middle. It's going to be a little bit off to my side. That's okay. The goal is to have the tip of your dilator go into the front of the disc in the middle of the spine, or as close to the middle as possible. All right, perfect. So you can see the spinous process, we're right in the middle. Go back to a lateral. So we're pretty much in the center of the spine. Now we actually got into the spine perfectly. Now, there's a band of tissue right in the middle in the front of the spine called the anterior longitudinal ligament, or ALL. And that's where you want to go. You don't want to go through the longus colli muscles. They're off to the side. I've done 1,000 anterior cervical discectomy and fusion surgeries, or ACDF surgeries. So I've dealt with those areas probably 2,000 or 3,000 times because I've done 2 discs, 2.5 discs per ACDF. So when I do an ACDF, I do it usually on 2 or 3 discs. Rarely do we do 1 disc shot. So imagine this is a surgeon who's done around 2,500 disc removals and fusions in 1,000 patients. Shot? All right. So we're pretty close to the back of the disc, and that's again 2, 3, 4, 5, 6. Everyone agree? Shot. So I want to get to the back here. Shot. And I want to bring my tube. That's right there. We're inside the tear at the back of the disc at C5-6 with the dilator. Now the whole surgery we're going to do is through this little tube.
Need a little headline?
That would be great.
Okay.
Thanks.
Got good blood pressure.
Huh?
Good blood pressure.
Yeah, it's perfect. You can do a little shoulder pull. And you can see we're in the left side of the neck, and her symptoms are on both sides, but mostly the left. But she's got weakness in both arms. I need the impactor. Right? Yep, I got it. Everybody pull and x-ray. Perfect. I want to watch the tip of my dilator. I don't want it going any further. Luis, will you help me watch it, please? So I'm doing just small 1 or 2 millimeter advancements of the tube along the shaft of the dilator. And as I get to the back of the disc, there'll be some compression of the tube. Just about done. Lift it up. Shot. Oh yeah, that's perfect. Let's bring it back just a little bit. Hold on. Take that off. I want to bring the dilator back just a little bit. Because where it is fine, but I don't want it going anymore. Right about there. Shot. We're off on orbit about 1 degree. Shot. And shot. Yeah, it's hard to move this thing forward right now because we're at the back of the disc. I think that's good. And again, we're off on orbit now by 2 degrees, maybe 3. So you went the wrong way, but that's fine. If you could line it up, it's fine. Go ahead, try. That's better. All right, still about 1 degree off, but that's fine. 2, 3, 4, 5, 6. So we're in the right disc that we're meant to be in based on the MRI, based on our symptoms. 20. And now we're going to head down this rabbit hole tube and we're going to find this herniation and get rid of it. Now, for those of you that watch my surgeries a lot, you know that it's not one herniation. It's probably got around 20 pieces. That's what we typically see, is around 20 fragments make up a herniation. It's one disc that's herniated, but it's got a lot of herniations. And then there'll be some bone spurs back there, which we'll clean up. Take your time. Take your time. All right. So I apologize. I'm not going to be able to answer questions during the session because our audio, two-way audio, is not working. You guys can hear me, I believe, but I can't hear you. And so what I'd like you to do is to type up your questions for me on YouTube or Facebook. Henry, I don't know if we've got any YouTube questions. I know we've gotten Facebook questions from our audience, but is YouTube streaming this as well? I hope it is. Typically, we get a lot of YouTubers asking questions during surgery, but I don't remember any YouTubers today. They've all been Facebookers. Is that Henry?
He said that everything is came in all the platforms.
Thank you.
A bunch of questions.
Thank you. Tell Henry, Henry, why don't we go ahead and show the audience a video on why people get neck pain from a herniated disc. Like, what's the mechanism there? What causes it? The answer is inflammation, but go ahead and watch this video and you can see exactly why people get pain in their spine from a herniated disc. And then we'll rejoin.
Traumatic injury on the disc can cause annular tears to form. Pressure on the disc causes herniation of the nucleus pulpus through the annular tear. Inflammatory tissue develops within the annular tear, causing neck pain. The inflamed annular tear generates pain signals. Additional injuries can cause worsening symptoms. Inflammation from the annular tear can spread to the nearby nerve roots, causing arm pain. Pain signals travel up the nerves to the brain, causing localized neck pain. Pain signals reach the primary somatosensory cortex, causing conscious awareness of neck pain. If you have a herniated or bulging disc and neck pain, submit your MRI for a free review at www.mri.deukspine.com.
Huh?
There you go. That's it.
Well, yeah, I didn't want it really off, but that's fine. Yeah, off's fine. Watch that with my head.
Yes, sir.
Good job today, Luis. Pushing it backwards. A lot of scar tissue here. Oh, look at that herniation. Damn. There's a really nice reverse herniation. I would say 15 minutes, doctor.
Thank you. She's doing well.
Good. Yeah, that last lady, we're giving her some oxycodone here, and Dr. DeMola is calling in the oxycodone. So, you know, I don't know if he really said I don't care. Seems like, yeah,
I don't think they want to.
that may be what they heard, but yeah. So, right? That's equally wrong to make a patient feel that way, but I'm sure I make people feel bad too, not on purpose, but I know he doesn't want to get in trouble and all that stuff, but are we back, Henry? All right. Trying to get this lined up a little better. There we go. Okay, very good. Well, we're here at the C5-C6 disc at the back of it where the herniation is, and if you've been watching, there's another herniation right there. So these things we're pushing against the spinal cord and the nerves, and now they're coming back into the disc, which is where we are. We're inside the disc, and we're welcoming them back in with open arms. And we're funneling them as soon as they come back into the disc. We're funneling them out through this tube right out here to the operating room, where they end up, if they're big enough, we send them off to the pathologist as a specimen, but mostly they just end up on the Ratex, and we just don't want them here. So in the back of the disc, we want to get rid of them, get them out of there. This is going quite well for her. She's stable. She's doing good. I'm glad it's 5-6 and not 6-7, because I don't know that we would be able to get 6-7. You know, it's one of the things that we don't talk a lot about, but some of these discs we can't get because of the patient's anatomy, and we never know that ahead of time. I mean, sometimes I could tell, like somebody with a really thick neck, I just won't be able to do the surgery. But this patient doesn't have a thick neck, but she has a short neck, because this is C5-6 right here, and we can barely get it. I have some patients with really long necks where you could actually get C7-T1 if you needed to. So this is herniation. You can see the laser is literally blasting it and vaporizing little pieces of the herniation. That's a calcium right there. That's a bone spur. When they talk about a disc osteophyte, that's the osteophyte part or bone spur part. So she's doing really well. Everything's going well for her. This is over in the right foramen. Just going to float these pieces out and get back to work. There's a bone spur right here, right there. So far, so good. Not having any problems. It's going well for her. Another bone spur right there. You can see it melts away with the laser. So people ask me, can the laser get rid of bone spurs? Absolutely. You know, the laser is your best tool for getting rid of bone spurs. There's no surgery tool better. A drill is far less precise. But look how precise the laser is. Just to give you an idea, you can see how the laser's working. That glass tube you're seeing there is the laser fiber that delivers the laser energy. That tube is 1/2 millimeter. So you know what a millimeter is. It's very small, a millimeter. That glass tube is 1/2 millimeter wide. So think about that. And you can get an idea. The laser actually has an effective range from the tip of 1/2 millimeter. So it's very, very safe. A drill bit, on the other hand, if you're drilling around the spine, a lot higher chance of ruining something, messing something up. All right, I'm going to come back the other way, head towards her other side. Need to advance the laser fiber again just a little bit. All right, if you have questions, I'm happy to answer them for you. Again, I just can't do that right now, as we don't have the ability for me to hear Henry's questions like we normally do. So we're asking that you type up your questions, and I'll be happy to answer them for you as soon as I'm done. Yes. Yeah, you can ask a question, of course. What comes out, you mean? Oh, all right, great question. So one of our nurses is asking, how come the fluid that comes out into the reservoir, the suction canister, how come there's so many different colors? And that's because it's a small world. It's a small world after all. No, it's because there's blue, right? And the blue is the dye. There's also the antibiotic that we use, which is kind of a betadine, so it's sort of a brown. I think I got it. And then there's blood, which is red. Right. And so then when you start mixing things like some more blood, a little bit of red and blue, makes purple, doesn't it? Red and blue, purple. And then if you get that betadine going, so we just have, different solutions. And then you got the white, right, from the steroid. So anyway, that's why. I think that's the answer. Yeah. Just different amounts of different things. Everybody's a little different. All right. Just about done. I'd say 5 minutes, doctor. I'm telling my anesthesiologist about 5 more minutes is what I expect. How's our irrigation? I feel like we're low. We're definitely low. I need irrigation. Yeah? No, I don't think so. There's something. No, spike a new one. I don't have any visibility. It's gone. Remember, that thing is a bladder. It pushes against the sac. If it's
the shadow is like still not touching, you know what I mean?
right, but if it's squeezed the bag together in the middle, but there's some at the end, you won't see it. I mean, you won't get pressure on it. It doesn't pressurize the whole bag, basically. Now, is it a pump or is it a bladder?
It's like a bladder.
How come we don't use the pump, Luis?
I mean, it's a pump, but it's a pump, basically. It's a pump, yes.
There's a
Just-
pump.
Yeah. It's push.
Like
the
a
bag.
peristaltic
Yeah.
pump?
Yeah.
Oh, it pushes the bag.
Push the bag.
Oh, it doesn't have a peristaltic pump. Oh, I think there are peristaltic pumps though, Luis. Sorry, we're just having a conversation about equipment. Ugh. I think there are peristaltic pumps. How come we don't use a peristaltic pump? You know what I'm talking about? Oh, you've never seen look up peristaltic pumps. Most orthopedic pumps are peristaltic. I thought that's what you had. I didn't realize we didn't have a peristaltic pump. All right. That side looks pretty good. Let's flip it. The other side. There we go. What's the problem?
Probably just this one over here.
Oh, look at that herniation. Just came out of the foramen. Right there. Look how smooth it is. Like, it looks like an asteroid. These are like asteroids.
The irrigation is good now, right?
It's, yeah.
I'm kind of
It's,
confused about it going to.
it's,
There was still a lot in here. In the
or,
left one.
nah, I don't know.
I don't know.
Connect that to a connection, please.
I honestly don't know. Bone spur here.
Good?
Yeah, that works. Thank
A
you.
lot of scar tissue. Just about done. Henry, let's let the audience see what the, I think you haven't shown the Deuk laser disc repair, right? Why don't we run that animation so they understand how the surgery works, and then maybe run the comparison to what this patient would be doing if we didn't have the Deuk laser disc repair available. We would be doing a anterior cervical discectomy and fusion in her case, which she didn't want, of course. Who wants to have their neck fused? Nobody.
Annular tear causes neck pain. Inflammation of the nerve roots causes arm pain. A Band-Aid-sized skin incision is made. A small tube is inserted without damaging the bone or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own. It can take up to 12 months. If you have a herniated or bulging disc and neck pain, submit your MRI for a free review at www.mri.deukspine.
Deuk laser disc repair, a comparison with traditional spinal fusion surgery. A symptomatic disc causing neck or back pain can include bulging discs, herniated discs, ruptured discs, degenerative discs, protruding discs, spinal stenosis, radiculopathy, and sciatica. This patient can choose traditional fusion surgery or the Deuk laser disc repair to help alleviate the pain caused by and within the symptomatic discs. Here, two patients with comparable disc injuries are treated. On the left, the highly invasive spinal fusion, and on the right, the least invasive Deuk laser disc repair. The spinal fusion requires a very large incision, usually leaving a large scar. The Deuk laser disc repair requires only a very small incision, usually less than a half an inch long. In this small opening, a cylindrical rod, called a dilator, is inserted to gently spread the muscle to create a small passage and guide through which the surgery is performed endoscopically. The incision for the fusion continues, including penetrating the skin, fat tissue, and multiple layers of muscle through to the bone. With the Deuk laser disc repair, a mallet is used to advance the tip of the dilator into the symptomatic disc. A tube, called the tubular retractor, slides over the dilator and is carefully positioned into the disc, again using the mallet. The rest of the entire Deuk laser disc repair surgery will occur inside this narrow tube. To access the spine, the spinal fusion requires the muscle to be separated from the vertebrae. This very invasive action causes trauma and permanent damage to the muscles. Whereas in the endoscopic Deuk laser disc repair, the muscle is not damaged. The endoscope camera is inserted into the tubular retractor to allow the surgeon to guide the laser inside each symptomatic disc. The fiber optic laser used in the Deuk laser disc repair is manipulated with great accuracy to remove only painful inflammatory tissue from the disc. In this highly magnified view, the laser is used to precisely remove damaged disc material that is causing the pain. The laser is debriding, or essentially vaporizing, damaged tissue in the disc's outer layer, or annulus, specifically at the annular tear, the source of the rupture or herniation and pain. After the fusion patient's damaged discs are removed, a metal or plastic cage housing bone grafting material is inserted in place of the removed discs. Fusion hardware, by design, is to fuse joints that normally move, preventing natural movement in the damaged portion of the spine. Whereas with the Deuk laser disc repair, there is no loss of movement. Normal movement and flexibility of the disc and joints is preserved. Once the laser has removed the painful part of the annular tear, the endoscope and tubular retractor are removed, leaving less than 1/2 inch incision in the skin, which is closed with a single stitch, Steri-strips, and a Band-Aid. Total time for the Deuk laser disc repair surgery, approximately 1 hour. The fusion, however, is still underway. Holes in the spine must be tapped in preparation for the large screws that anchor the fusion hardware. The Deuk laser disc repair patient is in recovery usually 45 to 60 minutes before released to go home. Meanwhile, bone graft material is placed throughout the fusion surgery site. These morselized pieces of bone will eventually grow together to help promote the fusion process. The Deuk laser disc repair patient is soon back home, enjoying life, with a very fast recovery, allowing normal activities without pain. Average surgery time of a traditional 2-level fusion is 2.5 hours, with an additional 3 to 4 hours in the recovery room. As we've seen, in comparison, a spinal fusion requires a much larger incision and results in a significant amount of scar tissue. The Deuk laser disc repair's 1/2 inch incision leaves no scar tissue around the spine or nerves. A large amount of bone is removed with a spinal fusion. With the Deuk laser disc repair, no bone is removed. Each disc is accessed through a natural opening in the spine. The entire disc is completely removed in a spinal fusion, even though only 5% may be damaged. The Deuk laser disc repair leaves the normal parts of the disc in place and removes only the painful annular tear on the damaged disc. Fusion requires hardware, including screws, rods, plates, etc. The Deuk laser disc repair does not require any hardware. The patient is totally hardware-free. Fusion surgery is very invasive. Cutting and moving the muscle structures and tissues for a spinal fusion causes trauma, resulting in permanent damage to the muscles. Whereas with the Deuk laser disc repair, there is no damage to the muscles. The Deuk laser disc repair is the least invasive surgery available to repair a damaged disc. With spinal fusions, patients are required to take highly addictive narcotic painkillers, which can cause constipation, bowel, and bladder complications. Due to the minimal pain, narcotics are not needed with the Deuk laser disc repair. Spinal fusions have a high risk for infection. The Deuk laser disc repair has a very low risk for infection. In the 7 years the Deuk laser disc repair has been performed, there have been no infections. Spinal fusion surgery has a very long recovery and requires a great deal of physical therapy and time to heal from the trauma in the muscles and the spine itself. Whereas the recovery from Deuk laser disc repair is in a matter of hours or days, rather than weeks or months. With fusion, the spine is being fused together, losing movement. Whereas there is no fusion with the Deuk laser disc repair. Normal movements of the joints in the spine is preserved. Spinal fusion results in loss of mobility. There is no mobility loss with the Deuk laser disc repair. In fact, most Deuk laser disc repair patients experience improved mobility after the surgery. The Deuk laser disc repair is FDA approved. All the instruments and equipment used are FDA approved. This proprietary surgery itself has been peer-reviewed and published and is performed exclusively at the Deuk Spine Institute. With the highest published success rate of 95%, the Deuk laser disc repair is proven to be the most successful and least damaging spinal surgery in the world for the treatment of symptomatic damaged discs causing back pain, neck pain, sciatica, and radiculopathy due to herniated, degenerated, or bulging discs.
I think the laser is the best thing out there to have with this type of surgery. It's all legit. That's all I can say about it.
Dr. Deuk Machen here at the Deuk Spine Institute. I'm with one of my patients who's traveled to us from Mississippi, and he came here for the Deuk laser disc repair to be done for a herniated disc on his neck, and he's now here today, just one day after surgery. How are you feeling today?
Feeling great. Feel like the weight of the world been lifted off my shoulders. Feels a lot less pain in my shoulder, no more tingling. Feels like my body's trying to recover back to normal. I think the surgery went very well, no problem whatsoever.
And you're just one day after surgery. Can you tell whether the neck pain is gone yet?
The neck pain is gone, and the pain throughout my shoulder, the tingling, everything is gone. A little soreness in my throat, my voice is a little harsh, but other than that, I feel great.
Awesome. Can you show us your incision? Oh wow, look at that. So you have a 4mm incision. You can see that right here on the surgical footage of the endoscope. We actually, when you watch the video, you can see all the herniated discs back there. We were pulling them out one at a time. You had about 20 pieces. And then you can see the nerve root right there in the foramen. And there's no herniated discs anymore on the nerve root. We got them all out of there. I had to open up the posterior longitudinal ligament and get all those fragments of disc herniation out of the epidural space that were pushing on your nerve. And I got a good look at everything and it looked fantastic. So I think you're gonna do great. Did you consider having like a fusion surgery? Did anyone offer you fusion before?
Yes, I was offered fusion. I was told that was the only surgery that could be done. I started Googling. I come across the laser surgery and I decided to give it a try. And I don't regret it. I think it was the best decision I ever made for my age, and I think the outcome would be a lot more better in the future. And it was a great experience. It really was.
And you work with metal as your job, so you didn't want metal in your neck, on your spine.
No, I think the cold weather would have had an effect on it. I think it would have caused an adjacent effect, is what they call it. When you do the fusion, it make the disc below it or above it wear out. And I'm 34 years old, and if I live another 30 years, I just feel like it would cause significant problems. I think the laser is the best thing out there to have with this type of surgery. It's all legit. That's all I can say about it.
This is Dr. Deuk Machen. I'm here with one of my patients who underwent the Deuk laser disc repair on his neck just yesterday. How you feeling?
I'm feeling better, a lot better. Already, after years of chronic neck pain, I'm already feeling better within 24 hours.
So is the pain that you had when you came here, do you still have that pain?
Not that pain, it's just, I think, a little bit from the surgery itself, but it seems like a lot of the numbness and the tingling in my hands went away, and already starting to feel a lot better.
Now you had a fusion done before, not by me, and you can see the scar there. And then you had the laser surgery done yesterday. And how would you compare the two experiences?
Night and day. I actually, when I had the fusion, had to go back to the hospital with complications. It just took a long time to recover from that. So this was much, much better.
Now, your fusion on your neck was done by a pretty famous neurosurgeon, right?
Correct.
Even with him doing it, there were still issues.
Yes.
What kind of problems did you have with the fusion?
Well, I went there for the numbness in the hand and still the chronic pain that I've had for many, many years. And it seemed to take away the numbness in my hand, but the pain was still there. So I spent many, many years going to chiropractors. I've had injections, I've had massage therapy, physical therapy, and it, most of them gave a little bit of relief.
Did any of them get rid of your pain?
Not completely, no. Just kind of made it bearable.
And is your pain gone now?
It's certainly getting there. I'm thinking probably within a week it'll all be gone.
And your surgery was done, even though you had a metal plate in your neck from your prior fusion, we were able to work around the plate and get in there and fix those discs, especially the C3-4, which was, you can see a lot of herniated disc material in there that was causing most of your symptoms. So I'm happy you're doing so well. And you had it outpatient, so you didn't even have to go to the hospital.
Correct. Yeah. Left in about an hour and a half.
What are you going to do now that we fixed your neck?
Well, I'm going to take care of it for the prescribed 6 weeks, and then hopefully I can start getting back to a normal life, be able to get back to golf and things I like to do. Dr. Deuk and his processes here and everything's amazing. If you have a lot of chronic neck pain or back pain, I would highly suggest coming to him.
Awesome. All right, my friend. Congratulations. It is February 23rd, 2022, and I'm here with one of my patients who's traveled from Kansas. Is that correct?
That's correct, Wichita, Kansas.
Wichita, Kansas, and clearly you've had surgery. We just did it less than 24 hours ago. You've got your incision there on your neck. How are you feeling today?
Much better. Much better. 26 years ago, I had a fusion of C6 and 7. They told me in Wichita that I would need to have fusions of C4 and 5 and C5 and 6. They set up the surgery for the 23rd March, and I'm going, I can't wait that long. This thing hurts, it's killing me, I cannot sleep, and so on. My husband Dale did a whole batch of research online, and he says, I want you to be able to move your neck after surgery.
Yes.
And
I did a
he
lot
did
of
a
Googling.
lot of research, and we found Dr. Deuk to be a man of integrity. He films all of his surgeries. He puts many of them online, and you can see for yourself all the good work that he's doing, and that he really likes to help people. What he does is generally not covered by Medicare and not covered by some other insurances, but it very well should be, because it really helps people.
So what was life like for you before surgery?
My pain was mostly in the neck and shooting down my shoulder, and especially in my shoulder.
And you had really bad weakness with your arm. You couldn't even lift your arm, right?
That's
before
correct.
Surgery?
That's correct.
Show us what you can do now.
Before surgery, I could lift it to about here, and now I can lift it.
All the way
Yeah,
up.
just the next day, right
You couldn't
after.
do that before.
Yeah, that's because she had a herniated disc, 2 of them, C4-5, C5-6, and the herniations were literally sitting on the nerve, and we got in there, and if you watch this video segment right here, you can actually see there's the laser, and as we're removing the herniation, it literally pops right out of the foramen where it was sitting on top of the nerve, crushing the nerve. So, and the surgery was a success. We lost almost no blood at all, and you can see your incision is tiny, and here you are one day after surgery. It was outpatient, and you're ready to go home, right? You guys flying
Going
back
home tomorrow.
tomorrow? Okay, very good.
Try and enjoy a little bit of Florida today before we go back to the snow.
Okay, it is snowing there, huh, in Kansas?
Probably.
Okay.
If not today, then tomorrow.
Well, stay another week.
And yesterday it was 70
I
degrees
wish.
there.
70 degrees where, in Kansas?
Or maybe that was the day before it was 70 degrees, and
nice.
then they woke up to about 11 degrees.
Ah, so the cold front came in. We get those from time to time, and it gets cold around 60 degrees. Well, most of the time it's very pretty here in Florida. Well, we're glad you're here. Is there anything else you want to say to the world about herniated discs in the neck and surgery?
Dr. Deuk will give you a free look-see on the MRI. It's well worth your time. and he will do a Zoom call with you and tell you what he can do for you. So go for it.
I said that it was so important that I said I'd pay for it. You know, because you know, we got a little bit of a nest egg, and sure it's going to cost a little bit, but it was worth it because we got results. I mean, that's amazing.
Your health is the most important thing in the world, people's health. So
You can't take it with you when you
yeah.
pass away.
All right, folks, we'll have a safe travels back.
Thank
Great
you.
to see you. Glad we can help you out. That's a nice.
Thank you.
That's a nice shake. All right, I'm here with one of my patients who traveled from Australia to Florida to the Deuk Spine Institute for treatment. And you look happy today.
Yeah.
Yeah? Why are you so happy?
I'm happy because my back pain is gone.
Your back pain is
and
gone.
my leg pain is gone from
Awesome.
the disc here.
From the surgery yesterday.
Surgery yesterday, yeah.
And you had the Deuk laser disc repair.
I had the Deuk laser disc repair, yeah, that's right, yeah.
So why did you come all the way to Florida from Australia for the Deuk laser disc repair?
I've been suffering from back pain and leg pain for nearly a year after an accident. So I did a lot of conservative treatment like physiotherapy, exercise physiology, but it hasn't cured my pain. The pain was chronic, and I've been suffering from a lot of issues, emotional frustrations and things, and sleepless nights. But a couple of neurosurgeons back in Australia has offered me a surgery. They both offered me a fusion, which I don't want to go for. So then I have looked into Dr. Deuk. I found Dr. Deuk, and he's doing an amazing job doing a laser technology and also doing very minimally invasive procedure. So I thought this is what I wanted, and it's a faster recovery. I could go back and work back within a couple of weeks. So that's why I traveled all the way from Australia to US.
Yeah, and we did your surgery just yesterday evening.
Yeah.
So it's around 12 hours.